Many people think kidney disease always causes severe pain. But here's the surprising truth. Your kidneys can lose a large amount of their function before you feel anything dramatic at all. In fact, some of the earliest warning signs are so subtle that they're often dismissed as just getting older. A little extra fatigue, swollen ankles after a long day, needing to use the bathroom more often at night. These changes may seem harmless, but sometimes they're your body's quiet way of asking for attention. If you're over 60, this is especially important. As we age, our kidneys naturally become less efficient. That doesn't mean kidney disease is inevitable, but it does mean that small changes deserve a closer look. Catching problems early can often help slow further damage and give you and your healthcare provider more options for protecting your health. Stay with me, because some of the signs we'll cover today are surprisingly easy to miss. And one of the final symptoms is something many people blame on dry skin or aging, when it may actually deserve a medical evaluation. The kidneys may not get as much attention as the heart or brain, but they quietly perform some of the most important jobs in your body, every minute of every day. They filter waste products from your blood, help balance fluids, regulate minerals like sodium and potassium, support healthy blood pressure, and even play a role in making red blood cells that carry oxygen throughout your body. Think of your kidneys as two highly efficient water treatment plants. Every day, they filter large amounts of blood, deciding what your body needs to keep and what should be removed through urine. When they're working well, you hardly notice them. But when they're under stress, the changes can show up in surprising places. From your skin and muscles to your energy levels, and even your sleep. One challenge is that chronic kidney disease often develops slowly over many years. Early on, many people feel perfectly fine. That's why doctors often call kidney disease a silent condition. By the time obvious symptoms appear, significant damage may already have occurred. The good news is that knowing the warning signs doesn't mean you should panic every time you notice one. Many of these symptoms can have several possible causes. The key is recognizing when a change is new, persistent, or occurring alongside other symptoms. That's when it's worth discussing it with a qualified healthcare professional who may recommend simple blood and urine tests to check how well your kidneys are working. Let's begin with one of the most commonly overlooked signs. Sign number 1. You're feeling unusually tired all the time. Everyone gets tired now and then. Maybe you didn't sleep well, spent extra time gardening, or had a busy day with the grandchildren. But kidney-related fatigue is different. It's often persistent. You wake up tired, stay tired during the day, and even simple tasks seem to require much more effort than they used to. Why can kidney problems make you feel this way? Healthy kidneys produce a hormone called erythropoietin. Its job is to tell your bone marrow to make red blood cells. Red blood cells carry oxygen to every part of your body. When the kidneys aren't working as well, they may produce less of this hormone, leading to fewer red blood cells. A condition known as anemia, with fewer red blood cells delivering oxygen. Your muscles and organs don't get the fuel they need to work efficiently. The result can be ongoing fatigue, weakness, shortness of breath during normal activities, and difficulty concentrating. There's another reason, too. When the kidneys don't filter waste products effectively, those waste materials can gradually build up in the bloodstream. This can leave people feeling drained, sluggish, or mentally foggy. Imagine trying to drive a car with both a partially empty fuel tank and a dirty air filter. The engine still runs, but it struggles. Your body can experience something similar. Take Margaret, for example. She's 72 and has always been active. She enjoys walking with friends every morning and volunteering twice a week. Over several months, she noticed she was skipping walks because she felt exhausted. She assumed she was simply getting older. It wasn't until a routine checkup revealed reduced kidney function and anemia that she realized something more was going on. Of course, fatigue has many possible causes. Poor sleep, thyroid problems, certain medications, depression, heart disease, and vitamin deficiencies can all contribute. That's why persistent tiredness shouldn't be ignored or self-diagnosed. If you've noticed a significant drop in your energy that lasts for several weeks, especially if it's affecting your daily life, it's worth mentioning to your healthcare provider. A simple evaluation can help identify whether your kidneys, or something else, may be contributing. And while fatigue is easy to dismiss, the next warning sign is something many people notice every evening without realizing it could sometimes point toward kidney problems. Sign number 2. Swelling in your feet, ankles, or lower legs. Have you ever taken off your socks at the end of the day and noticed deep marks around your ankles? Maybe your shoes suddenly feel tighter than they used to, or your rings seem harder to remove. Occasional swelling after a long flight or standing for hours is common, but swelling that happens regularly or gradually worsens deserves attention. Healthy kidneys help regulate the amount of fluid and sodium in your body. When they aren't filtering effectively, extra fluid may begin to accumulate in the tissues, particularly in areas affected by gravity, such as the feet, ankles, and lower legs. This type of swelling is called edema. It doesn't always hurt, but it can make your legs feel heavy, your shoes uncomfortable, and walking less enjoyable. Picture a kitchen sink with a partially clogged drain. Water still goes down, but more slowly than it should. Eventually, the water begins to collect, instead of flowing away efficiently. Something similar can happen when the kidneys aren't removing excess fluid as effectively. There's another reason swelling can occur. Healthy kidneys help keep important proteins, especially one called albumin, inside your bloodstream. Albumin acts like a sponge, helping keep fluid where it belongs. If damaged kidneys allow protein to leak into the urine, fluid may escape into surrounding tissues, leading to swelling. Robert, a 76-year-old retiree, noticed that his favorite walking shoes suddenly felt snug every afternoon. He assumed he needed a larger shoe size. Later, during a routine medical visit, his doctor found protein in his urine and recommended further kidney testing. While not everyone with swollen ankles has kidney disease, in Robert's case, it was an important clue that led to an earlier diagnosis. It's also important to remember that swelling has many other possible causes. Heart conditions, liver disease, certain medications, vein problems, and even prolonged sitting can all contribute. That's why it's essential not to jump to conclusions. However, if swelling appears suddenly, becomes severe, affects both legs consistently, or is accompanied by shortness of breath, chest discomfort, or rapid weight gain, you should seek prompt medical attention. For more gradual swelling, especially if it's becoming more frequent or is paired with fatigue or changes in urination, scheduling an appointment with your healthcare provider is a wise next step. They can determine whether your kidneys, or another health condition, need further evaluation. So far, we've talked about 2 warning signs that many people attribute to aging: low energy and swollen ankles. But the next symptom is even more common, and countless seniors simply assume it's a normal part of getting older. In reality, it can sometimes be one of the earliest clues that your kidneys are under stress. We'll explore that next. 2. One of the reasons kidney disease can be so difficult to recognize is that many of its early symptoms seem unrelated to the kidneys themselves. Instead of pain where the kidneys are located, you may notice changes in your sleep, your bathroom habits, or even your ability to concentrate. That's why paying attention to small, persistent changes in your body can make such a difference. Now let's continue with the third warning sign. One that millions of older adults experience but often blame entirely on aging. Sign number 3. You're waking up more often at night to urinate. Many people assume it's perfectly normal to make one trip to the bathroom during the night, especially after the age of 60. In many cases, that's true. But if you're suddenly getting up 2, 3, or even 4 times every night, and this is a new pattern for you, it deserves a closer look. Healthy kidneys adjust how much urine they make throughout the day and night. Normally, they produce less urine while you're sleeping, allowing you to rest without frequent interruptions. When the kidneys begin losing some of their filtering ability, this balance may change. As a result, your body may produce more urine overnight, forcing you to wake repeatedly. Doctors sometimes call this nocturia, which simply means waking during the night to urinate. Imagine trying to enjoy a full night's sleep while someone keeps turning on the bedroom light every couple of hours. Even if each interruption is brief, the repeated awakenings can leave you feeling exhausted the next morning. Poor sleep affects much more than your energy. Over time, interrupted sleep can affect memory, mood, balance, and even increase the risk of falls. A serious concern for older adults. Take George, for example. At 74, he noticed he was waking 3 times every night. He assumed it was simply because he was getting older. After several months, he mentioned it during his annual physical. His doctor ordered blood and urine tests that showed reduced kidney function. While his nighttime urination also had other contributing factors, those tests helped identify a problem much earlier than it otherwise might have been. It's important to remember that frequent nighttime urination has many possible causes. For men, an enlarged prostate is very common with aging. Certain medications, especially water pills called diuretics, can increase nighttime urination. Drinking large amounts of fluids or caffeine in the evening can also play a role. Diabetes, bladder conditions, and sleep disorders, such as sleep apnea, may contribute as well. That's why no single symptom can diagnose kidney disease. However, if you've noticed a new pattern of waking several times each night, particularly if it's happening along with swelling, fatigue, or other symptoms we're discussing today, it would be wise to bring it up with your healthcare provider. A few simple questions and routine lab tests may provide valuable answers. And speaking of urine, the next warning sign is one that many people feel embarrassed to talk about. Yet it may provide some of the earliest clues that the kidneys are struggling. Sign number 4. Changes in your urine. Most of us don't pay much attention to our urine unless something feels obviously wrong. But the appearance of your urine can sometimes provide important information about your overall health. Healthy kidneys carefully filter your blood, removing waste while keeping important substances like proteins and blood cells where they belong. When that filtering system becomes damaged, the urine may begin to look different. One possible change is foamy urine. Now, it's important to understand that seeing a few bubbles after flushing or urinating quickly isn't unusual, but urine that repeatedly appears unusually foamy, almost like the thick foam on top of a cappuccino, and takes time to disappear, could sometimes suggest protein is leaking into the urine. Doctors call this proteinuria. Protein is essential for maintaining healthy muscles, tissues, and fluid balance. Normally, healthy kidneys prevent significant amounts of protein from escaping into the urine. When protein leaks out, it may be one of the earliest measurable signs of kidney damage. Another possible change is blood in the urine. Sometimes the urine appears pink, red, or brown. Other times, The amount of blood is so small that it's only detected during a laboratory test. Blood in the urine doesn't automatically mean kidney disease. It may result from a urinary tract infection, kidney stones, certain medications, an enlarged prostate, or other medical conditions. But regardless of the cause, visible blood in the urine should never be ignored. It always deserves prompt medical evaluation. You might also notice urine becoming much darker than usual, despite drinking enough fluids. Or perhaps your urine output changes significantly without an obvious explanation. Again, these changes can have many causes, including dehydration, infections, medications, or liver problems. The important point is not to panic, but not to dismiss persistent changes either. Let's consider Susan, age 69. She noticed her urine looked unusually foamy for several weeks. She felt perfectly healthy otherwise and almost ignored it. During a routine checkup, she casually mentioned it to her doctor. A simple urine test revealed excess protein, leading to further kidney evaluation. Because the problem was detected relatively early, she was able to work with her healthcare team on strategies to help protect her remaining kidney function. Stories like Susan's remind us why paying attention to subtle body changes matters. You don't need to inspect every bathroom visit with worry. But if you consistently notice urine that looks different than usual, especially if the change lasts for several days or weeks, it's worth discussing with your healthcare provider. Routine urine testing is simple, inexpensive, and can reveal important clues long before more serious symptoms develop. So far, we've covered 4 warning signs that are often overlooked: persistent fatigue, swelling in the feet or ankles, frequent nighttime urination, changes in urine appearance. Each of these symptoms alone may have several possible explanations, but when 2 or more begin appearing together, they create a much stronger reason to schedule a medical evaluation rather than simply assuming it's just old age. Coming up next, we'll discuss a symptom that surprises many people because it doesn't seem connected to the kidneys at all. In fact, many older adults blame it on dry weather or aging skin, when it can sometimes signal that waste products are beginning to build up in the body. It's one of the easiest signs to overlook, and one you won't want to miss. 3. Many health conditions announce themselves with obvious symptoms. Kidney disease often doesn't. Instead, it quietly affects different parts of the body in ways that may seem completely unrelated. That's why understanding these less obvious signs can be so valuable. Let's continue with warning sign number 5. Sign number 5. Persistent itchy, dry skin. Most people expect dry skin as they get older. Aging naturally causes the skin to lose some moisture and elasticity. Cold weather, hot showers, or spending more time indoors can make it even worse. But sometimes the itching isn't just about dry skin. Healthy kidneys do much more than remove waste. They also help keep the right balance of minerals and nutrients in your blood, including calcium and phosphorus, which are important for healthy bones and skin. When kidney function declines, waste products and certain minerals can gradually build up in the bloodstream. This imbalance may contribute to skin that feels unusually dry, irritated, or persistently itchy. Doctors sometimes refer to this as kidney-related itching. It often isn't accompanied by a rash, making it especially confusing. People may try different lotions, soaps, or laundry detergents without finding much relief because the cause isn't only on the surface of the skin. Imagine forgetting to change the filter in your home's heating system. At first, everything seems fine, but over time, dust begins circulating throughout the house, affecting every room. In a similar way, when the kidneys can't remove waste as efficiently, the effects may begin showing up throughout the body, including the skin. Consider Linda, a 73-year-old grandmother who enjoyed gardening every morning. During one winter, she noticed her arms and back constantly itched, even after using moisturizing creams. She assumed the cold weather was to blame. At her next doctor's appointment, routine blood work showed her kidney function had declined since her previous visit. While dry skin alone doesn't diagnose kidney disease, it became one more clue that encouraged further evaluation. Of course, itchy skin has many possible causes: allergies, eczema, liver conditions, reactions to medications, thyroid disorders, diabetes, and simple dryness are all common explanations. The important message isn't that every itch means kidney disease. Rather, if persistent itching is new, difficult to explain, or appears alongside other symptoms like swelling, fatigue, or changes in urination, it's worth mentioning during your medical appointment. Sometimes several small clues together tell a much bigger story. And that brings us to the sixth warning sign. One that many people mistake for ordinary aging because it develops so gradually. Sign number 6. Muscle cramps and restless legs. Have you ever been asleep when a sudden leg cramp jolted you awake? Or perhaps your legs feel restless in the evening, making it difficult to sit still or fall asleep. Occasional muscle cramps are common. They can happen after exercise, dehydration, or even sitting in one position too long. But frequent cramps may sometimes point to something deeper. Healthy kidneys carefully regulate important minerals called electrolytes. These include potassium, sodium, calcium, and magnesium. These minerals help your muscles contract and relax properly. They also support healthy nerve function and maintain your heartbeat. When the kidneys aren't balancing these minerals effectively, muscles may become more likely to cramp, twitch, or feel weak. Think of your muscles like an orchestra. Each musician has to play at exactly the right time. Electrolytes are like the conductor keeping everything in rhythm. If the conductor becomes confused, the music becomes disorganized. In your body, that disorganization may appear as painful cramps or muscle spasms. Some people with reduced kidney function also develop restless leg syndrome. This condition creates an uncomfortable urge to move the legs, especially during the evening or while lying in bed. The sensation has been described as crawling, tingling, pulling, or aching deep inside the legs. Because movement briefly relieves the discomfort, many people find themselves constantly shifting position or getting out of bed. This repeated interruption can make it difficult to get restorative sleep. Poor sleep then contributes to fatigue the next day, creating a cycle that's difficult to break. Let's look at another example. David is 71 and enjoys taking evening walks with his wife. Over several months, he began experiencing painful calf cramps almost every night. He increased his water intake, stretched before bed, and even bought a new mattress. But the cramps continued. During a routine checkup, his physician reviewed his medications, checked his electrolyte levels, and ordered kidney function tests. While several factors were contributing to his symptoms, identifying reduced kidney function helped guide his treatment plan. Again, muscle cramps alone do not mean someone has kidney disease. Many medications, including certain cholesterol-lowering drugs and water pills, can contribute. Poor circulation, nerve conditions, dehydration, vitamin deficiencies, and overuse of muscles are also common causes. The goal isn't to assume the worst. The goal is to recognize when frequent cramps become part of a larger pattern that includes several of the warning signs we've discussed today. If that's happening, bringing the complete picture to your healthcare provider can be extremely helpful. Doctors often solve health puzzles by looking at all the pieces together rather than focusing on just one symptom. We've now covered 6 warning signs that are commonly overlooked. Persistent fatigue, swelling in the ankles and feet frequent nighttime urination, changes in urine, blistered itchy skin, frequent muscle cramps, or restless legs. None of these signs alone confirms kidney disease, but together, they can serve as an important reminder that your kidneys may deserve a closer look. Coming up next, we'll discuss 2 warning signs that many people never associate with kidney health. One affects your ability to think clearly, while the other can quietly change the way food tastes and even reduce your appetite. These symptoms often appear so gradually that family members notice them before the person experiencing them does. Don't miss these final 2 signs. They could complete the picture that many seniors overlook for. As you've probably noticed by now, the kidneys influence far more than just urination. They help keep your body's internal environment balanced. When that balance begins to change, the effects can reach your brain, your digestive system, your muscles, and many other organs. That brings us to warning sign number 7. Sign number 7. Trouble concentrating or feeling mentally foggy. Everyone has moments when they walk into a room and forget why they went there. As we get older, occasional forgetfulness becomes more common, and that's often a normal part of aging. But there is a difference between occasional forgetfulness and a persistent feeling that your mind just isn't as clear as it used to be. Some people describe it as brain fog. You may have trouble following conversations, balancing your checkbook, remembering appointments, or staying focused while reading a newspaper or watching television. Simple decisions may suddenly seem more difficult. Why might kidney problems affect the brain? Healthy kidneys continuously remove waste products from your blood. When kidney function declines significantly, some of those waste products can build up over time. This can affect many organs, including the brain. Kidneys also help maintain healthy levels of electrolytes and support the production of red blood cells. If kidney disease contributes to anemia or mineral imbalances, your brain may receive less oxygen or function less efficiently, making concentration more difficult. Think of your brain as a high-performance computer. If the power supply becomes unreliable or unwanted files begin filling the hard drive, the computer doesn't stop working immediately. Instead, it gradually becomes slower and less efficient. Your brain can respond in a similar way when your body's internal balance is disrupted. Consider Helen, who is 75 and enjoys playing bridge every Thursday with her friends. Over several months, she noticed. She had more difficulty remembering the rules of games she had played for years. She also found herself rereading the same page of a book several times, because the information just wouldn't stick. At first, she worried she might be developing dementia. Fortunately, her doctor performed a thorough evaluation. Blood tests showed several issues, including reduced kidney function and anemia. Treating the underlying medical problems helped improve her energy and mental clarity. This example highlights an important point. Brain fog can have many different causes. Poor sleep, medication side effects, depression, anxiety, thyroid disorders, vitamin B12 deficiency, infections, dehydration, uncontrolled diabetes, and early memory disorders can all contribute. That's why it's essential not to assume the cause. Instead, think of persistent mental fog as a signal that deserves a conversation with your healthcare provider, especially if it's accompanied by several other symptoms we've discussed. Early evaluation may uncover a treatable condition. Now, let's move to our 8th and final warning sign. Sign number 8. A loss of appetite or a metallic taste in your mouth. Most of us have days when food simply doesn't sound appealing. Perhaps you've had a mild stomach bug, or you're feeling stressed. But if your appetite gradually fades over several weeks, or foods you've always enjoyed suddenly taste strange, It's something worth paying attention to. Healthy kidneys remove waste products that would otherwise remain in the bloodstream. As kidney function declines, those waste products may begin affecting your sense of taste and smell. Some people describe a metallic taste in their mouth. Others say their favorite meals suddenly taste bland, bitter, or different than they remember. Because eating becomes less enjoyable, they naturally begin eating less. Over time, poor appetite can contribute to unintended weight loss, muscle loss, weakness, and reduced energy. For older adults, this is especially concerning because maintaining muscle mass becomes more difficult with age. Muscles are essential for balance, mobility, and maintaining independence. Losing muscle increases the risk of falls, fractures, and slower recovery from illness. Imagine putting low-quality fuel into a car every day. Eventually, the engine won't perform at its best. Your body depends on good nutrition to repair tissues, maintain muscle, support your immune system, and keep your organs functioning well. When appetite declines for an extended period, your body simply doesn't receive the nutrients it needs. Let's look at another example. Frank, age 78, noticed that coffee no longer tasted right. Soon afterward, meat seemed to have an unpleasant metallic flavor. He gradually started skipping meals because nothing sounded appetizing. His daughter became concerned. After noticing, he had lost nearly 10 pounds over several months. When he visited his physician, blood work revealed declining kidney function along with several nutritional deficiencies. While kidney disease wasn't the only factor affecting his appetite, identifying it early allowed his healthcare team to create a plan that included dietary guidance and close monitoring. Again, appetite loss can result from many different conditions. Digestive disorders, certain medications, infections, depression, dental problems, cancer, and other chronic illnesses may all play a role. That's why persistent appetite changes should never be ignored or dismissed as just getting older. If you've unintentionally lost weight, food tastes unusually metallic, or your appetite has been poor for several weeks, make an appointment with your healthcare provider. These symptoms deserve proper evaluation. Now we've reached the end of our 8 warning signs. Let's quickly review them together. Pistol-triggered fatigue. That doesn't improve with rest. Swelling in the feet, ankles, or lower legs. Frequent nighttime urination. Changes in the appearance of your urine. Postured itchy, dry skin. Frequent muscle cramps or restless legs. Trouble concentrating or ongoing brain fog. A reduced appetite or a metallic taste in your mouth. Remember, none of these symptoms automatically means you have kidney disease. Many have several possible explanations. But when multiple symptoms appear together, or when a symptom is new, persistent, or worsening, they shouldn't simply be written off as part of aging. Your kidneys are remarkably resilient, and many people with early kidney disease have no obvious symptoms at all. That's why routine checkups are so important, especially if you have risk factors such as high blood pressure, diabetes, heart disease, obesity, or a family history of kidney disease. Simple blood tests can estimate how well your kidneys are filtering your blood, while urine tests can detect protein or blood long before you notice obvious symptoms. Finding kidney problems early often gives you more opportunities to protect the kidney function you still have. In many cases, careful control of blood pressure, healthy blood sugar management for people with diabetes, avoiding tobacco, staying physically active, maintaining a healthy weight, eating a balanced diet, and using medications exactly as prescribed can all help support long-term kidney health. It's also wise to discuss all prescription medicines, over-the-counter pain relievers, vitamins, and herbal supplements with your healthcare provider or pharmacist. Some medications and supplements can affect the kidneys, particularly when taken frequently or in high doses, and your healthcare team can help you use them safely. The most important message from today's video is simple. Listen to your body. Small changes may not seem important on their own, but together they can provide valuable clues about your health. Paying attention doesn't mean living in fear. It means giving yourself the best chance to catch potential problems early, when there's often more that can be done. If you found this video helpful, we'd love to hear from you. How old are you, and which of these 8 warning signs surprised you the most? Have you or someone you care about experienced any of these symptoms? Please share your experience in the comments below. Your story may encourage someone else to schedule a checkup or ask an important question at their next doctor's appointment. If you enjoy practical, evidence-based health information designed especially for adults over 60, be sure to subscribe and join our growing community. Every week, we share simple strategies to help you stay healthier, stronger, and more independent for years to come. Thank you so much for watching. Take good care of yourself, and I'll see you in the next video. 5. As we finish today's discussion, there's one final thought that's worth remembering. Kidney disease is often called a silent condition, but that doesn't mean your body stays completely silent. More often, it whispers. Those whispers may come in the form of subtle changes that are easy to overlook. A little less energy than usual, ankles that seem slightly puffier each evening, waking up more often during the night, or food simply not tasting the way it used to. On their own, these changes may not seem alarming. In many cases, they're caused by something entirely different. But when several of these signs appear together, or when they persist despite your usual healthy habits, they deserve attention rather than dismissal. One of the most powerful things you can do for your long-term health is to become familiar with what's normal for your own body. No one knows your daily routines better than you do. If something feels different for weeks instead of days, don't assume it's just part of getting older. Instead, make a note of it and bring it up during your next medical visit. Keeping a small health journal can be surprisingly helpful. You don't need anything complicated. Simply write down changes you notice, such as how often you're waking up to urinate at night, whether swelling in your ankles is getting better or worse, any unusual changes in your appetite, new or worsening fatigue, muscle cramps that happen repeatedly, changes in your weight without trying, any persistent itching or changes in your urine. These observations can give your healthcare provider valuable information that may not be obvious during a brief office visit. It's also important to know who faces a higher risk of kidney disease. You may be more likely to develop kidney problems if you have high blood pressure, diabetes, heart disease, a family history of kidney disease, obesity, a history of smoking, or if you've regularly used certain pain relievers, such as non-steroidal anti-inflammatory drugs, for long periods without medical guidance. Having one or more of these risk factors doesn't mean you'll develop kidney disease. It simply means regular monitoring becomes even more important. Fortunately, protecting your kidneys often overlaps with protecting your heart, brain, and blood vessels. Some of the healthiest habits include keeping your blood pressure within the target range recommended by your healthcare provider, managing blood sugar carefully if you have diabetes, drinking enough fluids for your individual needs, unless your healthcare provider has advised you to limit fluids, choosing a balanced eating pattern that emphasizes vegetables, fruits, whole grains, beans, healthy fats, and appropriate portions of lean protein. If you already have kidney disease, your healthcare provider or a registered dietitian may recommend specific dietary adjustments based on your stage of kidney function. Staying physically active with exercises appropriate for your fitness level, such as walking, swimming, cycling, or gentle strength training. Maintaining a healthy weight, avoiding tobacco products. Getting enough quality sleep each night. Taking medications exactly as prescribed and discussing any over-the-counter medicines or supplements with your healthcare provider before using them regularly. These aren't miracle solutions, but they are well-supported habits that benefit nearly every organ in your body, including your kidneys. Another important reminder is not to skip routine checkups simply because you feel well. Early kidney disease often has no symptoms at all. That's why routine blood tests and urine tests are so valuable, particularly after age 60, or if you have conditions like diabetes or high blood pressure. These simple tests can detect problems long before you would notice them yourself. Finding kidney disease early doesn't just provide answers. It often provides opportunities. Opportunities to slow progression, opportunities to adjust medications if needed, opportunities to improve lifestyle habits, and opportunities to work closely with your healthcare team before more serious complications develop. Remember, today's video is meant to help you become more aware of your health, not to diagnose yourself. If you recognized one or even several of these warning signs, don't panic. Many of these symptoms have causes that are unrelated to kidney disease. The next step isn't worry. The next step is a conversation with a qualified healthcare professional who can evaluate your individual situation and recommend the appropriate testing if necessary. Knowledge is most powerful when it leads to thoughtful action instead of unnecessary fear. Thank you for spending this time with us today and for taking an active role in your health. Every step you take toward understanding your body is an investment in your future independence and quality of life. Now we'd love to hear from you. How old are you, and what country are you watching from? Was there one kidney warning sign in today's video that surprised you the most? If you've already made healthy lifestyle changes that have helped you feel your best, share them in the comments. Your experience could inspire someone else who is just beginning their healthy aging journey. If you found this video useful, consider subscribing and joining our community. We publish evidence-informed videos every week on healthy aging, heart health, brain health, diabetes prevention, mobility, nutrition, and practical ways to stay healthier and more independent after 60. Until next time, take care of yourself, stay curious about your health, and remember, small healthy choices made consistently over time can make a meaningful difference. We look forward to seeing you in the next video. Point 5. As we finish today's discussion, there's one final thought that's worth remembering. Kidney disease is often called a silent condition, but that doesn't mean your body stays completely silent. More often, it whispers. Those whispers may come in the form of subtle changes that are easy to overlook. A little less energy than usual, ankles that seem slightly puffier each evening, waking up more often during the night, or food simply not tasting the way it used to. On their own, these changes may not seem alarming. In many cases, they're caused by something entirely different. But when several of these signs appear together, or when they persist despite your usual healthy habits, they deserve attention rather than dismissal. One of the most powerful things you can do for your long-term health is to become familiar with what's normal for your own body. No one knows your daily routines better than you do. If something feels different for weeks instead of days, don't assume it's just part of getting older. Instead, make a note of it and bring it up during your next medical visit. Keeping a small health journal can be surprisingly helpful. You don't need anything complicated. Simply write down changes you notice, such as how often you're waking up to urinate at night, whether swelling in your ankles is getting better or worse, any unusual changes in your appetite, new or worsening fatigue, muscle cramps that happen repeatedly, changes in your weight without trying, any persistent itching, or changes in your urine. These observations can give your healthcare provider valuable information that may not be obvious during a brief office visit. It's also important to know who faces a higher risk of kidney disease. You may be more likely to develop kidney problems if you have high blood pressure, diabetes, heart disease, a family history of kidney disease, obesity, a history of smoking, or if you've regularly used certain pain relievers, such as nonsteroidal anti-inflammatory drugs, for long periods without medical guidance. Having one or more of these risk factors doesn't mean you'll develop kidney disease. It simply means regular monitoring becomes even more important. Fortunately, protecting your kidneys often overlaps with protecting your heart, brain, and blood vessels. Some of the healthiest habits include keeping your blood pressure within the target range recommended by your healthcare provider, managing blood sugar carefully if you have diabetes, drinking enough fluids for your individual needs, unless your healthcare provider has advised you to limit fluids, choosing a balanced eating pattern that emphasizes vegetables, fruits, whole grains, beans, healthy fats, and appropriate portions of lean protein. If you already have kidney disease, your healthcare provider or a registered dietitian may recommend specific dietary adjustments based on your stage of kidney function. Staying physically active with exercises appropriate for your fitness level, such as walking, swimming, cycling, or gentle strength training. Maintaining a healthy weight, avoiding tobacco products. Getting enough quality sleep each night. Taking medications exactly as prescribed and discussing any over-the-counter medicines or supplements with your healthcare provider before using them regularly. These aren't miracle solutions, but they are well-supported habits that benefit nearly every organ in your body, including your kidneys. Another important reminder is not to skip routine checkups simply because you feel well. Early kidney disease often has no symptoms at all. That's why routine blood tests and urine tests are so valuable, particularly after age 60 or if you have conditions like diabetes or high blood pressure. These simple tests can detect problems long before you would notice them yourself. Finding kidney disease early doesn't just provide answers. It often provides opportunities. Opportunities to slow progression. Opportunities to adjust medications if needed. Opportunities to improve lifestyle habits. And opportunities to work closely with your healthcare team before more serious complications develop. Remember, today's video is meant to help you become more aware of your health, not to diagnose yourself. If you recognized one or even several of these warning signs, don't panic. Many of these symptoms have causes that are unrelated to kidney disease. The next step isn't worry. The next step is a conversation with a qualified healthcare professional who can evaluate your individual situation and recommend the appropriate testing if necessary. Knowledge is most powerful when it leads to thoughtful action instead of unnecessary fear. Thank you for spending this time with us today and for taking an active role in your health. Every step you take toward understanding your body is an investment in your future independence and quality of life. Now, we'd love to hear from you. How old are you, and what country are you watching from? Was there one kidney warning sign in today's video that surprised you the most? If you've already made healthy lifestyle changes that have helped you feel your best, share them in the comments. Your experience could inspire someone else who is just beginning their healthy aging journey. If you found this video useful, consider subscribing and joining our community. We publish evidence-informed videos every week on healthy aging, heart health, brain health, diabetes prevention, mobility, nutrition, and practical ways to stay healthier and more independent after 60. Until next time, take care of yourself. Stay curious about your health, and remember, small healthy choices made consistently over time can make a meaningful difference. We look forward to seeing you in the next video.